in.
Hello, my name is Dhruv Patel. I work here doing food. And what's your name?
Stephanie.
What's bringing you in today?
Physical assessment for a job.
Okay, can you verify your full name?
Stephanie Clark.
Okay, and your date of birth?
February 26, 1998.
Okay, let me see your armband. Okay, thank you. I'm going to pull the curtain for the privacy. Hand hygiene. So the wells are up, bed is locked and low. Do you need to use restroom before we start anything?
No.
Okay. We'll start with your vitals first things, with the temperature. That goes under your tongue, okay. And I'm going to do your pulse. Your pulse was good, 76. And your breathing was fine, 13. I left it at the same time while taking your pulse, so you're not trying to change it. And the temperature was 98. Next, we're going to do your pulse ox. That will show us the oxygen saturation in your blood. $99, that's perfect, great. Okay, and the last thing we're going to do is your blood pressure. Which arm you prefer? Doesn't matter, okay, we'll do it on your right. Make sure the cuff is not too loose or tight, because that will give you a variation in numbers. That was good, 118/76, that's perfectly fine, normal weight. Do you have any pain today, like in between a scale of 0 to 10, like where 0 is none and 10 is the worst?
0.
0? Do you know your height?
5'4".
Okay, and your weight?
168.
Okay, and do you know how old are you?
21.
Okay. And what gender you identify yourself as?
Female.
Okay. So as being on the general survey, patient presents the clear articulations of speech, no signs of impairment, and pleasant, dress according to the seasons, and well grown. So we're going to check some neurological exams that will show us the functions of neurological functions. The first thing I'm going to do, I'm going to put an object in your hand, and you will tell me what it is. Okay, close your eyes and tell me what it is. Okay, and I'm going to draw a letter in your hand and tell me what it is.
8.
Okay. And do you know what date is?
Tuesday.
Okay, and what month?
April.
Okay, and can you tell me what building we are in?
Hamilton Hall.
Okay. So with this, patient shows alert orientations with time, place, and situation. And what I did before with putting a few things in her hands shows the negative signs for stereogenesis. And graphithesia, where I draw something in patient hand with the eyes closed and they're able to identify what was it. Can you lay down this on the back? I want you to go down from your heel to shin, from your knees to down. And do with the opposite leg as well. Touch my finger with your finger and touch your nose back and forth 5 times. Do the same thing with the other hand. And follow my finger and touch it where it goes. Okay. And can you get that done with me? The finger to nose and heel to shin, that shows us the normal functions of the cranial nerves as well. And I'm going to check your patellar reflex on your knee. Is there any pain or anything in the knee? No. Okay. Let me see your hand. Do you have any pressure ulcers or anything like any rash on the skin?
No.
Okay. So skin appear to be pink, moist, and warm to touch. I'm going to check the skin turgor for the dehydration purposes. There is no tanning in the skin as well, and so it's good to think like we're getting summer out here, so you should use like SPF, some rates of sunscreen on your skin to protect some damages.
Okay, thanks.
There was no skin turgor present. Patient is optimal hydrated. You're gonna palpate your scalp. Any recent changes in scalp? Any bumps or anything that you may be aware of?
No.
No. Try to palpate your frontal maxillary. Let me know if you feel any pressure or pain. Is there any pain or pressure you feel?
No.
Okay. And I'm going to do your lymph nodes. Preauricular, post-follicular, cervical, your submental, submandibular, and last I'm going to check your axillary. I'm going to put my hand against your face and try to go against the resistance, and do it the other side. Great. I'm going to check your mandibular joint. Can you open and close your mouth? Okay. Do you have any pain or clicking jaw problems with that? Yeah.
No.
Can you smile? Puff your chin. Eyebrows down. Okay. Close your eyes tight. That shows us the normal function of the cranial nerve 7. We'll try to palpate your thyroid gland. Look on the side. Try to swallow. If there is no enlargement of thyroid gland, and when you feel that, you should feel the thyroid gland going down while the patient swallows. Try to move your shoulder against my strength. Okay, that shows us the functions of cranial nerve 11. Okay, we're going to do your eye test. Okay. And try to follow this pen. Okay. Take off your glasses or something. Okay, follow this pen here throughout. Okay, this patient's eyes are equal, round, and relative. Pupils are good. Accommodate to light, and the peripheral visions are good as well. I'm going to do the one more test. I'm going to try to close your eyes. One side, yep, and follow my finger, and see where you can tell. Did you see that finger coming up?
Mm-hmm.
Okay, and do the other eyes closed, and tell me when you can see it.
I see it.
Okay, that shows us also the good functions of peripheral vision. I would like to have you stand here and check your vision. Simply check glasses back. With your one side eyes closed, read the lowest line you can.
FELOPZD.
Okay, and do with the other eyes closed.
FELOPZD.
And open both eyes and read the line which one you can read the lowest.
FELOPZD.
Okay, that's great. That shows us the 20/20 normal vision. Okay, now we're going to look into your ears. Okay, so the patient is adult. You pull your pinna back and up and look through. Okay, so that is a tympanic memory, probably great, that's normal. And a little wax present. That is good for lubrication and protection for the ear. And I'm going to do a whisper test. I will tell you 3 words on your ear behind and let me know what that is.
Apple. Ball. Cat.
Okay, I'm going to do the same thing with the other ears.
Hard. 2. 3.
Okay, so the patient's presence good, hearing, and there is no impairment present. With your eyes closed, I'm going to give you something to smell and let me know what that is.
Okay.
Ready?
Yeah. Coffee grinds.
Alright. So I'll try to inspect your nose. Okay, there is no deviation present, no nasal polyps. Nose appears to be nice, pink, and moist. Given there's no allergies that affect your nose or anything this time. Yeah. Close your one nostril and try to breathe through the other one. And do as well with the other one. Okay, great. So the breathing is euphonic. Open your mouth for me. I'll try to inspect your tongue and the uvula. Say Okay, tongue is midline as well the uvula. Tonsils are +1. They're present. No signs of inflammations on tonsils. I'll check your gag reflex. Open your mouth for me. Okay. That's normal. It's supposed to be present there. Okay, and I'll look through for any jugular vein distension. There is none present. There is no backflow of the blood through those veins. I'll try to palpate your apical pulse. So the apical pulse is located at the 5th intercostal mid-clavicular line. Yeah, that's present. It's normal. So now we're going to listen to your heart sounds. For heart sounds, the normal you should listen to it's S1 and S2. There shouldn't be any S3, S4 with the extramoral sounds. So start with the aortic and follow through till the mitral. Yeah, that's good. That was S1, S2 normal. There's no extramoral sounds. So the way you do the heart sounds, you start with the aortic, follow through pulmonic, herbs, tricuspid, and mitral. Now, will you lay down, please? I'll try to palpate your pulses. Let's start with your radial and brachial here. The radial and brachial present in upper hands and arms. They are +2 nostrils, normal. And I'm going to check your femoral, popliteal. Be the last one. Yep, they both are present, +2 nostril. As well, the T-ball is present on this side, normal here too. So as the patient is here, I'm going to check your capillary flow in your legs. Yeah, it's present. It's between 1 to 2 seconds. That shows us the good peripheral circulation. As well, there's no signs of pitting edema. Now you can sit back here. Can you breathe and in out? Deep breath in, deep out. Okay, that's a normal chest expansion, symmetric. Say 99.
99.
Say 99.
99.
Keep repeating.
99.
Keep repeating.
99.
Okay, that shows the tactile fermenters. You should hear clear vibration, know the different sounds. Ask you to your long sounds. For long sounds, you start in the Z formation and listen on the skin. You should not do it directly in the clothes because that affects the sound, belt and diaphragm as well. bad. Now say 99.
99.
Say 99.
99.
Say one more time.
99.
Say E.
E.
One more time.
E.
One more time.
E.
Okay. So with E, you should hear clear E. You should not hear any different sounds. Like E shouldn't be hearing like A, and 99 should be clear as well at the same time. Okay, we do long side. For the long side, you usually start with the earpiece and the clavicle side. So patient present with eupenic breathing here, normal, no abnormalities. There's no other sounds present like adventitious sounds like bronchi, murmur, or anything. Okay, so we're gonna check your abdomen. Will you lay down, please? This is the only function system in your body for the abdomen. Like for other, you start with inspection, palpate, percuss, and auscultate. But with this, you start with inspection, look through, then you do auscultate before you percuss or palpate. Because before touching or anything, that will make the sounds go more hyperactive, and you should hearing normoactive sound. You don't want the sounds to go low. So, okay, so the patient's stomachs appear to be round, flat, contours, symmetric. There is no signs of other presence. Any umbilical is midline. No pulsation as well. Okay. Now I'm going to auscultate your sounds. For hearing sounds, the normal pattern is starting from the right lower quadrant and follow through the other side to the left lower quadrant. And the sounds you should be hearing are the normoactive sounds. They're present every around 5 seconds, and hyperactives, they are like too sudden off. And hyperactive where you don't feel any sound unless more than 30 seconds. Let's try the percuss for any signs of. Okay, that was a resonant sound. And last, we're going to percuss for any signs of liver or spleen enlargement or any organs around the abdomen. Okay, they are none. You can sit back here. The last thing we're going to do, check your musculoskeletal functions. Let's start with your range of motions. Extend your flexion hands. Rotate them. Okay, try to rotate on side, shoulder. Okay, rotate your wrist again. Supine pronate. Okay, extend and flex your knee. Okay, your ankle. Okay. Now would you stand up on this line? And try to walk on your tippy toes. And back on your heel. Turn back around and walk heel to toe. Okay, now you can get back here. Try to touch your toes straight up. Yep. The spine alignment is normal, present. Now there is no signs of deviated align. And stand here for 20 seconds. I'll be here to check for a rhombic test. And you should not be swaying or anything. Right? So close your eyes and stay 20 seconds up. Okay, so that was the good 20-second patient's presence, negative signs of rhombic test. So that was our total health assessment. What do you like to do here today? And anything else we can help you?
No.
No? Great, thank you.